If you think preeclampsia is just a high blood pressure reading, you're missing the big picture and you're gonna miss the points on your exam, okay? We're doing a zero fluff, total deep dive into preeclampsia and eclampsia using my textbook, Murray 8th edition. So if you wanna pass your maternity finals, grab your notebooks because we're going deep. But guys, before we start, hit that save button and share this with your study group. We're covering everything from vasospasms to magnesium toxicity. Drop a in the comments if you're ready to master the most tested topic in OB. So step 1 is the okay? Pathophysiology. According to my textbook, okay, the root cause isn't just the heart, it's the placenta. For reasons we don't fully understand, the spiral arteries don't remodel correctly, all right? This triggers a massive systemic vasospasm. Think of it like a kink in a garden hose happening all over the body, okay? This vasospasm causes leaky vessels, which leads to protein escaping the blood, which is known as proteinuria. And this also leads to leaking into the tissues, okay, which is known as edema. Most importantly, though, it causes decreased organ perfusion. The brain, the liver, the kidneys, and the placenta are all starving for oxygen. That is the why behind every symptom we see. Step 2 is risk factors. So you have to know who is at risk to catch this early, okay? So think nulliparity. These are first-time moms, all right? Watch for the extremes like moms under 19 or over the age of 35. Pre-existing conditions are a huge red flag. Think chronic hypertension, type 1 or type 2 diabetes, and obesity. Also look for overdistension of the uterus. That means twins, triplets, or polyhydramnios, okay? If there's a family history of a mother or a sister having preeclampsia, your suspicion should be through the roof. Step 3, manifestations. Preeclampsia versus severe features, all right? So we have to be specific here. Standard preeclampsia is a blood pressure of 140/90 or higher on 2 occasions, at least 4 hours apart, and 20 weeks gestation. But the NCLEX, from what I've learned, love preeclampsia with severe features. So watch for these signs, okay? Blood pressure of 160/110 or higher. A persistent, worst ever headache that doesn't go away with Tylenol, all right? That's cerebral edema. Visual disturbances like blurred vision or scotoma, which is like seeing spots, right? Severe epigastric or right upper quadrant pain, that is the liver capsule stretching, and it's a sign of impending seizure. You also see 3+ or 4+ deep tendon reflexes and clonus, which is like that rhythmic tapping when you dorsiflex the foot. If you see clonus, the central nervous system is extremely irritable and a seizure is coming, okay? Just be mindful. Step 4, diagnostics. So we're not guessing, right? We need the data, we need the facts. So the gold standard is the 24-hour urine collection showing 300 milligrams of protein or more. We also look at the HELLP, that's HELLP, syndrome markers, right? Hemolysis, low H&H, elevated liver enzymes, and low platelets, that's less than 100,000. We check creatine creatine levels. If they're over 1.1, the kidneys are failing. For the baby, we're doing biophysical profiles and non-stress tests to monitor for intrauterine growth restriction because that placenta just isn't performing. Step 5, nursing interventions. Our priority is seizure prevention, and that means magnesium sulfate. This is a high alert medication. This is a central nervous system depressant that relaxes the smooth muscle. So your nursing role is critical here. You must check vitals and deep tendon reflexes every 15 to 60 minutes, okay? Look for signs of magnesium toxicity. So that's respiratory rate under 12, loss of patellar reflexes, urine output less than 30 milliliters per hour, and sudden sweating or flushing. If you see these, stop the infusion immediately and give the antidote, which is calcium gluconate. Safety is the only priority here. Step 6, education and evaluation. How do you know as a nurse that your patient is actually getting better? You are looking for the diuresis phase within 24 to 48 hours after delivery or after a successful treatment. The kidneys will start to wake up. You'll see a massive increase in urine output. sometimes over 3 liters a day. You'll see the edema in the face and the hands start to decrease, but most importantly, the central nervous system stabilizes. The headache disappears, the visual spots goes away, and those jumpy 4+ reflexes move back to a normal 2+. Okay, when the blood pressure stays consistently below 140 over 90 without aggressive meds, you know the vasospasms finally resolve. Okay, y'all, stop overcomplicating study sessions. All right, use the details, trust your knowledge, okay, and let's crush these exams. And don't forget, I'm gonna always leave you with this: never dim your light for anyone. Stay lit.